provision that as it was just described, to make sure that the providers fulfill a responsibility to provide information to the IG?
We do, Mr. Chairman.
Thank you. And you've talked a lot about measures of quality, actually the absence of measures of quality. Is there a standard way of, it's maybe an IG issue as well, how do you define, what's the criteria for determining quality of care? How do you measure it?
Thank you. So in the community care, in a managed care setting, quality of care is measured differently than in a direct care setting. It's just as important, it's equally as important, but it is measured slightly differently. In our setting, we are not handing over lives to the responsibility of the TPA. We maintain the responsibility of the veterans. We are not capitating, lives or anything like that. So the veterans' outcome measurements, their quality metrics, that measures both internal quality and external care quality. So focusing on the outcomes of our veterans, whether that's cancer treatment or cardiovascular or diabetes, whatever those disease pathways may be, the outcomes are what we want to make sure that we're measuring, and that will be indicative of both direct and external care.
And that's the outcomes, or whether a person got better, whether they recovered, whether their lives were extended.
Exactly. The outcomes, their direct outcomes from their disease pathway. And also in external care, there are national quality metrics, core measures, CMS measures, inpatient hospitalizations, your length of stay, your hospital-acquired infections. There are indications that are national metrics that we can pull systematically, that the TPAs in our next-gen contracts, we are going to require them to pull that. When you get down to direct providers like primary care providers, it does get more difficult, and that's where you need to rely on the outcome of the veteran's disease process. I mean, that's ultimately the measure of quality of care. Did the patient get better? Did the care work? So all of that is what's really exciting about what we're building, is that will be wrapped into the next gen, and we don't have that now. We just don't have capabilities to visualize.
And when you say we don't have that now, what you're really saying is we've never had that. I mean, it's never been since the Mission Act, or maybe since choice, the ability to compare hasn't existed. But even within the VA direct care, that quality measure has or has not been present.
And the VA in direct care has a very robust quality metric system. I can't speak to it personally, but there are people who can, and it is very robust for veteran outcomes. I'm saying that that's indicative of both direct and community care, because veterans are getting both. So if their outcomes are good, then that's measuring both. What is new in our current legacy contracts, we do not require the TPAs we do not put into those contracts to measure quality. We have put that into our next generation contracts, so that is something that we then will be able to hold the TPAs accountable for, and we'll be able to get that information.
The current existing contracts, they have an expiration date, and is there a plan that then what you want to replace those contracts with will be available to replace it at the correct time?
Yes, sir. As we approach there's a rolling termination of the contracts. There are they don't all end at one time. So the first contract will end at the end of this year, and we will have to work with OGC and SAC to make sure that we bridge those or have plans in place, so that by the time the next generation of contracts are in place, there's seamless coverage.
And no one's raised the topic of dental care, and I believe that's becoming a new opportunity within the contract. Would you explain that to the committee?
Yes, sir. So in current state, our two TPAs, dental is within the medical contracts. In next generation, we've pulled dental out. It is a specialty niche kind of service. And we feel that one national contract for dental will allow us to build a more robust network and be able to, we've had some IG investigations with regard to dental payments. It will allow us to fix those situations, make sure that our rates are consistent. So there will be a national dental contract.
Does dental care for veterans cover the wide gamut of dental care? Like,
It does. There are, and I will have to phone a friend on that. I can't speak to all of the dental coverages, but it is a robust services. There are robust services.
Mr. Topping, one of my legislative priorities, a significant one on this committee, remains adoption of the Access Act. It would build on the Mission Act and, in my view, help the VA deliver better access, convenience, quality care in the community, particularly for veterans with mental health and addiction issues. I want to express my appreciation for the feedback and technical assistance that you have provided in the Access Act. The Access Act passed this committee last year with bipartisan support. The ranking member and I are working together to reach an agreement on how to get it passed in the Senate. Does the VA continue to support the Access Act? And if it is enacted this year, like I hope it will be, would the Access Act help or hinder the goals laid out in the RFP?
Mr. Chairman, so Access Act was the first firefight I was dropped into after being confirmed, and I had a chance to work with your staff. Everybody supports the goals of increased access to mental health treatment for veterans. But when we came in, there were issues with how would we do this? How do we pay for this? How do we operationalize this? And the team spent a lot of time working on how we would do this. Number one, the goal on expanded access is absolutely the type of thing that VA can and should be working on. And one of the things that VA does perhaps better than even in the community, VA's mental health treatment. So that's number one. But then paying for it requires on how we're going to operationalize that. And so one of the things that the staff that we all worked on were, what are the tools that VA needs to operationalize this type of program? And so where we've landed on are the types of things, regional opportunities, the ability to pivot pilots that may be different in different areas based on different requirements, different capabilities, infrastructure. Those are the tools and capabilities that are built into Next Gen. So the things that VA would need to do to operationalize in a fiscally responsible way on Access Act are built into Next Gen. We have that capability in that contract. And so, if and when Access Act is passed, VA stands ready to implement that.
They are compatible.
Yes, sir, they are.
Thank you. Senator Blumenthal?